All right. Let me start this slideshow. All right. So my name is Jenna. I'm really happy to be with you guys today. So the title of today's talk is Attunement and Co-Regulation. And I picked this topic because I work a lot with parents and kids and families. And I wanted to really get better at this and really noticing how important it is for working with families. So one quick thing before I start is that most of the resources I'm using are typically for kids who experience trauma. I think they're still useful for kind of all of our caseload, but that is the bent. And you'll also notice that I do tend to work with slightly younger kids. But again, I think this would be useful for any age group when you're working with kids and families. All right, so I'm going to start out with some definitions. These concepts are pretty basic and foundational, so I'm not going to go into lengthy definitions, but we'll define them. We'll talk about why this is important. And then I want to spend a little bit of time talking about specific provider to caregiver attunement. So I think we miss that sometimes, and we miss that opportunity. And then we're going to practice. We'll break it down into curiosity and mirroring, and then I'll just share some tools that have been useful for me in practicing this with caregivers, with kids, and together. All right, so the bulk of the resources are coming from this book, Treating Traumatic Stress in Children and Adolescents. In short, it's called the ARC framework. It's evidence-based, and I found it to be really useful. So the authors define attunement as the capacity of the caregivers and children to accurately read each other's cues and respond in a way that maintains rhythm, supports a co-regulated state, and meets needs. So this is a definition, but it's also a goal, and it's a great goal. If we can do this work, it's super helpful. And I highlighted caregivers because that will be the emphasis for this talk. How do we do this well with caregivers? Okay, why is this important? When caregivers can accurately read their kids' cues and respond appropriately, it establishes safety. It fosters that healthy attachment. It also frees up the child to do all the other things that they need to be working on. That's really hard for them to do if they don't have this established safety. It's essential to developing future relationships. Pretty big deal. And this last one I really love. It is a pathway to experience mutual enjoyment and delight. It is really hard to enjoy your kid if you do not know what is going on with them and their behaviors are difficult and you just don't get it. It's really hard to enjoy that. And I think we need a lot of parents who are at that place where they're just done. And these last three, why it's important, are more focused on why it's important for us as providers to do this first with caregivers. So when we attune to the caregiver, we're helping them regulate, and that can help them learn how to modulate. And if we can impact the caregiver, we can shift the whole system, and that makes a huge difference for the whole family. So it's kind of it's ambitious, but it's a great thing to shoot for. Also, when we attune to the caregiver, it kind of cracks open that door for relationship building and nurturing a strong, healthy attachment. And typically parents come to us with behaviors, and they're not really looking at the relationship piece. When we're attuned to them, we can bring that in and they're able to hear it. And finally, and this is super important with kids with traumatic experiences, it allows caregivers to respond to the underlying emotions and needs rather than just seeing all this distressing behavior. All right, so let's jump in. Provider caregiver attunement. Imagine with me that a mom comes in, she's in the waiting room, you come to get her, she's with her child, and this is an incident of that happens often, is like just gobbling up the hand sanitizer, you know, mom's super frustrated, he's bathing in it, she's losing her cool, she's like, ugh, you know, why aren't you listening to me? This is embarrassing. And I'm naturally a pretty cheerful, positive person. I'm like, hey, it's so good to see you guys. I'm excited to meet you. Let's go back to my office. You know, I'm being myself. I'm using some mirroring, like, oh, that looked hard. Let's talk about it. How is that mom gonna feel in that moment? So maybe I'm using some mirroring skills, but my affect is totally off for where she's at. So we want to use the mirroring that I'm not going to go a ton into because I feel like you guys probably already know this, but we can reflect, we can validate, and we can normalize, and we absolutely should. But if our affect is off, it's going to feel disjointed. So I love this pool metaphor, that the metaphor that we typically see in meme form is, you know, somebody in a pool treading water, you know, juggling all these different things, and somebody's throwing them a life jacket, and of course they're not going to be able to catch it. So our job as providers, I like to think, obviously don't throw them the life jacket, don't try to fix it right away, they're not going to hear you. And really, we can't start taking things out of their hands either, we're just meeting them. But we can jump into the pool with them, tread water beside them, and from that perspective, start reflecting, validating, normalizing. If mom's up here, then I go up there with her. Oh my goodness, that is really hard and frustrating. I can tell that you're probably exhausted right now, and that makes total sense to me. You can see how these behaviors are tough. It's really a whole body experience to really be attuned. And we miss it when, you know, the kid's the identified patient. I tend to go straight to the patient. What are his behaviors like? What's going on? And we miss this opportunity to really connect to the caregiver. It's also a great time to explore their own affect management, right? When are the toughest times for you? I can tell that you're frustrated. And then also to bring in, when has it felt easier? Tell me about some good times with your child, and start bringing in that affect management piece with the caregiver. It's going to be a lot easier to do that if you've been attuned with them from the beginning. So mirroring, we're going to go back to this when I talk about kind of how to teach it to the caregiver to child. Reflecting, validating, normalizing. Use it first with the caregiver. All right, so attunement, I'm going to break it down to curiosity, and then co-regulation, which is really those mirroring skills. So once we're really great, we are tuning with the caregiver, we are connected, there's trust there, then we can kind of start to teach how they can be attuned to their child. First, just observe, and this can be a relief for a parent who is really in distress. You don't have to fix anything right now. We are just going to observe. Before we can manage this behavior, we're really going to try to understand it. And that can help kind of set this pace, slow it down a little bit, and set those expectations that we're not going to fix it right away. We're really going to look at what these behaviors are about. This is super hard to do when they're in a distressing situation. So start with a positive affect. What does your kid look like when they're excited, when they're happy? What changes about their body language? Start with something easy. Help them think about, okay, your kid's 12, but when they're angry, what stage do you think they're really in that place? How is it different from their age? Let's bring those expectations down. How does your child communicate different emotions, and how do they soothe? I love Dan Siegel's book, The Whole Brain Child. And he has this great illustration of, right brain, left brain, and how for our children, we want them to be in that river of well-being, right in the middle, and not hit the chaos, which is kind of the right brain, emotions, not hit the left bank, which is very rigid. So giving this parent kind of this image, when is your child in the middle? When are they hitting the banks? And then pulling in also, again, their own affect management. When are you feeling the chaos? When are you feeling rigid? How are you responding to these really hard times? Start with easy affect. Strong affect tends to derail curiosity, just kind of shuts it down because you're overwhelmed. So kind of build up to it. And how do we practice this? So the goal in practicing is to understand your child's language for emotion and build up your family's shared language for affect. So you can both be really good at identifying your affect, but if you don't share that information with each other, you don't have that shared language, and there still can be some misattunement. So this ideally is parallel work. With the caregiver, you're working on increasing their understanding of the child and developing purpose in their response. They feel prepared to respond. They're figuring out their own affect, and they feel confident. The child, you're working on increasing their own self-understanding of their affect, how they express it, and to increase their control. So you can do this separately, and then you bring it together in joint sessions. Set some ground rules for those joint sessions. Like I like to say, clarifying is fine. Mom, you can totally ask, tell me more about that, but we're not going to correct right now because we're just sharing. These are some worksheets that I like to use to practice. These are worksheets that I would give to the caregiver. This first one is my favorite one. You can use any emotion, learning your child's emotional language, put anger up there. All right, let's break it down. What does their face look like when they're angry? What's their tone of voice? You go through each one to really try to understand what your kid looks like with X emotion. What is that experience like for them? This other one is about being triggered. I find that it's really hard sometimes, especially with young kids. We're not going to figure out what the specific triggers are, but we can figure out what our kid looks like when they're experiencing a trigger and kind of flesh that out a little bit. Affect regulation. This one I really like to use with the parent, and how to, so when they're going through these, what does my kid look like when they're angry? Then I'll pull this up and be like, okay, where are you when your kid is doing this? Are you in this sweet spot, 4 to 7 in that river, or do you tend to kind of shut down and be super permissive? Or are you shutting it down and you are like, oh no, I'm shutting all these behaviors down. You're going to your room for the next 2 weeks, where are you? And how can we get to that sweet spot more often? This is my favorite tool for kids. And I have this animal background because I love using animal with kids. Everybody has pets or wants a pet. And kids seem to be really in tune with their pets. If I ask a kid, how do you know your dog's upset? They have an answer. So I'll kind of start there. How do you know your dog's upset? How do you know your cat is sad? How do you know you're upset? What's that like for you? So then we'll pick an emotion, say anger, and we'll use these anchors. And I'll give an example. So I'm working with this mother and daughter. They have this pretty volatile relationship where they're just kind of always in conflict, and that conflict just goes up, 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 and they're both out of control. So I was working with daughter on exploring her anger, and she loves cats, and she figured out that she is a cat. And when she's playful and happy, And this 0 section, she's a little kitten. And then all the way when she's at 100, she is a lion. She is ready to attack. It feels good because she feels powerful. She is aggressive and she is out of control. That's her lion. So she had all this insight into what that was like for her. We shared it with mom. She heard her. And the next time they were in that spiral, it didn't fix everything, right? This isn't magic. But mom was able to say, you feel like a lion to me right now, and I feel attacked. I can't do this because I feel attacked and it's kind of scary for me. We need to come down to bobcats before we can talk again. And they did, and they went away, and wasn't perfect, but daughter was able to hear that way more than if mom had done her typical, you're out of control, go to your room, I cannot handle this, you're ridiculous, because they had that shared language and it made sense. Okay. So once we have that shared language, it becomes a little bit easier to mirror, to do those in the moment co-regulation. So when we're co-regulating, it's typically in the moment of distress or of a big emotion, and we're actively trying to influence that emotion and that affect and energy. So we start with all emotions are valid and allowed. Daughter is allowed to feel like a lion. She's allowed to feel like a lion, but she also has to feel like a lion without hurting everyone around her, which typically means she needs to remove herself. So reflecting, validating, normalizing. This is a really, really hard ask for parents and caregivers to do in the moment of distress. This is really hard, specifically when the behaviors are irrational and personally hurtful. And acknowledging that to the parent is helpful. This is really hard. I'm asking you to not take it personally when your child is telling you to go F off. And I'm asking you to reflect on how, your kid is really, really angry and saying hurtful things, and to tell them how it makes sense. This is a really hard ask. So acknowledging that. Also exploring with the parent. This is a good time to explore, okay, what's kind of your deal breaker? When nope, can't do this, and let's explore that a little bit, and why that's so hurtful. Don't rush to fix it, just do the mirroring. This will only be successful if the parent feels pretty in control of their responses, which requires us to practice it first in session. It's probably not going to be successful to just give your parent the information and ask them to go do it. They need to practice it with you. And practicing with them, like, you get to be the crazy toddler, or you get to be the defiant teenager when you practice it. And that really can help your attunement too. Like, you're really understanding how terrible the situation is for the parent when you act it out. And that can build that trust and rapport and continue to build it. How do we practice this? Again, goal is to influence your child's affect or energy, or both, in the moment of distress. I have found it easiest to start with just, let's imagine it. Let's go back. So this is you and caregiver alone. Let's imagine a time where you guys are in distress, where you weren't responding the way you wanted to. Child was really up there. Let's talk about, okay, how could we reflect in that moment? How can we use our mirroring skills? What we would have done differently? Really imagine it first and practice. Another kind of easy one that feels good, I think, is to use check-ins. And then here's a picture of a check-in I did recently. So I do this with almost all of my patients. It's the first thing we do. We write out, we draw like the little emojis, the different feelings, And then on top of them are basically kind of degrees. Are you feeling a little bit sad, medium sad, happy sad? And then at the bottom, we have our energy. Are we feeling super energetic? 10, 9, 10. Are we feeling no energy? So the kid identifies how they're feeling, and then caregiver identifies how they're feeling and their energy. In this case, the kid was a 10, and he was all over the place. He was definitely a 10. And so we said, today our work is to read a book together. That is not going to happen if you are a 10. So let's do some deep breaths, or let's do some jumping jacks and then squeeze our muscles real tight, do those co-regulation and bring that energy down. And you do that in the moment, and it's pretty encouraging for the parent to see, okay, yeah, we can do this. Bring the energy down, and then we can read the book. Play. I think probably all do play. Play is a great way to kind of match the kid's energy. Use the mirroring and PCIT. It's the pride skills and play therapy. It's that empathetic listening and reflecting to bring the kid down or to help them focus, whatever affect you're trying to influence. And you can do that together in session, be pretty successful at, and build on that. And here are just some more check-ins. The middle one is the one that I already pointed out. The one on the left is a kid with a ton of affect. You can see it by how he does his faces. The kid on the right is a kid with tons of trauma and very restricted. And that was really good for the provider to see, like, man, we really have got to work on processing some of these emotions, because you can see how they need that. Another thing that I found helpful is for some families, right when the kid gets home from school, it starts, the behaviors, the picking. So doing a check-in when you get home from school, let's do a check-in then. What are you thinking? What are you feeling? What's your energy like? All right, what are some tools that we can use to help improve this? Okay. So these are some practice things that we do. So to summarize kind of what we went over, attunement is a foundational strategy. It's foundational skills for healthy relationships. I think in my note I put, it's the foundation for all things good. It really is essential. Start with the caregiver's experience. I know that I typically tend to miss that opportunity and then end up reacting to the parent when they join in with a behavior problem. And that's when I get to see them, when they're like, this behavior. So with that, design your treatment plan with a plan to include the caregiver from the beginning. And this has been super helpful for me because I wasn't doing that. And again, I was just reacting to these behaviors. Mom would come in and be like, this behavior is terrible. And 9 times out of 10, in order to address that behavior, I really need mom to be involved. But if I haven't done the attunement work with her, she's not going to do that hard work because we don't have much of a relationship, and she's not going to trust me to do that hard work when she comes with the behavior. So have a plan to include the caregiver as much as possible. Practice. Integrate the didactic work into your sessions. Explore the resistance to practicing. There's usually a good reason. Explore that. Use your mirroring skills. Nothing is wasted. And this, I often tell parents, and I think it was Dr. Swagger who I heard her kind of give the advice of, like, tell parents that they are the intervention, essentially. Like, how they respond to their child is the intervention. And I like to build on that and tell parents, every time you respond calm, consistently, you are doing the work. You're doing it. And I like to think that the same is true of us as providers. Every time we respond consistently, calmly, in an attuned way to caregivers, it shifts something for them, even if it's minimal and it's helpful and it's not wasted. And I find that to be pretty hopeful, and I need that in this line of work. And lastly, talk to your colleagues, and that's kind of how I want to end it. What have you guys found helpful in engaging parents? I'd love to hear some strategies that you guys have used. That's it, Mithra.
Thank you so much, Jenna. That was a wonderful presentation, and I loved all of it, and I really appreciated the common language. That's so true, and in any situation too. So thank you so much, Jenna. But yeah, we would love to hear some thoughts from the group. If anyone else has some experience and would like to share some of their experiences with the group as a whole, feel free to unmute and ask away or share some thoughts. It's a quiet group today. I promise we're all nice. You're welcome to chat in as well, and I'm always happy to read it out loud.
I love this presentation. Thank you, Jenna. I feel like this is going to help me with my daughter as well. I mean, just for whenever I'm in the mood. So thank you.
I'm so glad. I feel similarly.
I have to share that piece of advice, Jenna, does not come directly from me. It comes from a personal experience of watching it happen with my own kids and being told by actually the NICU nurse, because this goes all the way down to early biology. For those of you that know me, my son was about 10 weeks premature and had about a 6-week NICU course, and it was incredibly stressful. And I could walk in the room, even when I knew he's a little infant, stressed and tense, and even touching him, you could see his blood pressure shoot up on the monitors in the NICU and struggle. And and then it would make me worse and be real dysregulated. And one of the nurses was like, they can feel you, they read you, your response is how they regulate. And so that really came from a lot of real detailed information of seeing that regulation. And it really, really is true. It's kind of really putting parents, not just the intervention, but sort of in that teacher mode, that they only learn this by modeling and watching you. But it's also, I think, very empowering for parents to hear that they can do something, because sometimes it's that feeling of not knowing what you do. And sometimes I say, well, you fake it till you make it. I walked in that NICU room stressed out as hell, but I faked it. And then I saw that blood pressure come down. And so it really is really, really hard to do, but really powerfully effective, and gives both parties a really good sense of control. I had not heard your version of some of those worksheets and the thermometers and the animals. And I love that. That's such a fabulous sort of analogy of getting people to describe feelings that are so great. This was fabulous. Thank you so much, Jenna.
Thank you so much for sharing that, Dr. Swagger. Amanda, I noticed you unmuted.
Yeah, I would have to say I totally agree. I love the animal thermometer. I wrote it down because I thought of a patient that I worked with today, and I was like, that would have been fabulous to work with her. So I love the ARC pieces. I love the illustration of the whole child brain. So I read that audibly, and I didn't see the illustration. So I was like, yes, I love that. And so I talk with parents a lot about that. And so using that illustration will be super beneficial. But I've seen Jenna do this, and I think she is amazing with it, and amazing with the check-in and helping parents and children regulate. It's amazing to watch it in person too.
Thanks. So the book is really worth getting, because the whole book has little comic illustrations of how you can translate these kind of complex skills and read like a comic book and with the child, so that they can understand the skills. Another piece that I forgot to mention that he pulls out is to have, you can have survive goals and thrive goals. And sometimes we just don't get to the thrive goals because it's too stressful, and that's okay. But then you have your survive goal. And that would be like, in this really difficult interaction, mom's survive goal is to not lose it completely and just yell. That's her survive goal. Her thrive goal is to do the full on mirroring. And so it's not all or nothing. You know, you don't just fail. There's a spectrum here.
And Jenna, I'll be attaching your PowerPoint presentation in the recap email, but if there's anything about the book that you'd like me to share, anything further about it, just shoot me an email and I'll include that as well. Any other thoughts or comments from the group, or maybe some experiences that you all have had and would like to share with everyone? Well, I know even in my personal relationships, I'll be using like the animal language. Like, I'm feeling like a lion today. So I really appreciate all the things you shared with us, Jenna, today. So thank you very much. We got a chat from Dr. Swagger. Way to go, Jenna. Thank you for a wonderful presentation. All right, well, if there are any further questions or thoughts or anything, as always, shoot us an email and I'll make sure to have them as addressed and sent back to you. The only announcement that I have is that our next session is actually going to be December 1st, which is really crazy to say. And Dr. Lillard will be discussing self-care for providers. So keep an eye out for that reminder. I hope you all have a wonderful holiday next week, and we'll see you guys next time. Thank you so much.
Thank you. Bye-bye.